Very good evening to everyone. This is your host, Vance, here on a different topic today. Yesterday I met you, and today I'm meeting you again at Kopi with Vance. And as usual, before we start our talk show, the cup, the signature, and you can see actually the fumes coming up. It's coffee right now. Okay, cheers to everyone. So I hope everyone is having a wonderful evening today. Holiday season has just started up. I'm sure everybody is safe, keeping yourself healthy and fit. And today we are back again on a different topic. Like yesterday, we talked about the past is not the future. And today with me, with my guest speaker, Dr. Mohan Nagendram, consultant gastroenterologist. And today's topic is your gut health. That's right. The most important organ that we have in our body. One of the importance. In fact, there are so many other important organs in our body, but gut is one of the important. Before we even jump into the topic itself, I'm just going to touch a little bit of things that you can have a healthy gut. Get enough sleep. You got to eat slowly, stay hydrated, check for food intolerances, change your diet, and lower your stress level. I think one of the stress level also causes a lot of too much of stress on your body and your whole, including your gut system as well. But I'm not going to do the talk today. I'm just going to host it. And today with me is Dr. Mohan Raj. So I'm going to bring him up on board, and then we're going to have a very great discussion today regarding about your gut health. So I'm going to bring up Dr. Mohan. Where you, sir? Come on, come in up. Hello, Doc.
Hey. Hi. Good evening, Vance. Good evening, everyone.
How are you, Doctor, today?
Fine, very well.
Rested. You're looking very fresh and very glowing. You have this glowing look, like I said. What is the secret behind?
Nothing. Healthy gut.
That's a very good one. Thank you, Doctor, for joining us at Kopi with Vance. And I know you have a very tight schedule. And of course, with that, you have actually allocated 1 hour of your expertise and your valuable time with us with Kopi with Vance. But Doctor, before we even jump into the topic, it will be best if you can do a basic introduction of yourself so that all our viewers will know who is Dr. Mohan Raj.
Yeah. Good evening, everyone. I'm a gastroenterologist based in a town called Klang, about half an hour from Kuala Lumpur, Malaysia. I work in a private hospital, a Pantai group of hospitals. I did my medical training and in Malaysia, in UK, and my gastroenterology training in Singapore General Hospital. I was in Singapore General Hospital doing my postgraduate training. I completed it, and I came back to Malaysia in 2007. And ever since coming back, I've been practicing gastroenterology and general medicine in Pantai Hospital in Klang. I deal with both medical patients as well as gastroenterology patients, but mainly gastro. Gastro meaning issues related to the gut, upper gut, lower gut, endoscopy, and so on.
Thank you, doctor, for that humble introduction. But before we even get started on the topic itself, um, we most of the time we hear this, but I think you be the best person um, targeting this and answering that. But it is not planned for. I never even discussed about this question for you. But gut feeling, we always hear this most of the time. I know it caught you as a surprise, but it's going to be easy peasy for you. Sometimes we say, hey, I got this gut feeling. And I know what exactly is happening because of your hormones and your central nervous system, so much of things. But I think, doctor, it will be a pleasure if you can just start out with this and then we can just jump into other topics that you have planned for us. So why they always call it gut feeling?
I really don't know, but in my opinion, gut feeling means some intuition, intuitive feeling. But they call gut feeling. Maybe it comes from somewhere down there. I'm not sure.
Okay.
But
But
good question.
in terms of medical, doctor, is it the hormones, something like nervousness, the
Yeah.
anxiety?
Definitely, definitely. Whenever you're caught up in a situation, whatever it may be, there definitely some something connected to the brain that certainly would definitely may stimulate something in the gut that causes that some runs in the tummy, whatever you call it. And that's why they call it gut feeling. I think so. I'm not sure.
Okay. Thank you, doctor, for that. But I do believe in this very strongly. And most of the time, they say that, your brain makes very rational and very precise decisions where your heart is become very emotional. And the gut is always collecting data and then giving you some kind of informations, to make the decision or to stay protected and to be safe and to prevent you from getting danger or harm. That's a field of the whole hormones and chemicals that we have. It's a different topic that itself that we can dive into, but today's topic is all about gut, knowing your gut health. And doctor, before we even start with that, what gives you or what makes you the interest of pursuing on gut related background or gut related issues?
Okay. When I was doing my housemanship in a place called Kuala Terengganu, I worked under this eminent gastroenterologist called Panir Silvam and another guy called Mohan Shukri, who actually stimulated my interest in gastroenterology. And when I was there, when I trained with them, though I was only a houseman, but they take me up to the endoscopy suites and all that to show me what the tummy looked like, what the colon looked like, and things like that. And that really stimulated my interest, and that's why it all began. Then I went on to do my MRCP, which is actually a specialist physician. And of course, you have to train in all different fields, including cardiology and endocrinology and all different medical specialties. But after finishing, I still held that interest in gastroenterology, and that's why I decided to pursue it. I did some gastro training in Kuala Lumpur, Malaysia, in Hospital Kuala Lumpur, and thereafter I applied to do my further training in Singapore, which I did in Singapore General Hospital under a group of great gastroenterologists over there.
Thank you, doctor. Thank you for that. And now we are going to go into the topic itself that we have planned for. And of course, we are seeing here the whole. Oh, sorry, I just got to smaller it up for you. Okay. So yes, doctor. So regarding about this, I know you said you want to talk a little bit about this. So how does this system starts, or what is it? I know digestive system is always about the food that we eat, and that's all people know. Nothing more deep on that. But if you can just take through us, that would be fantastic.
No, basically, this picture over here shows you the upper GI system, which encompasses the esophagus, the swallowing, the gullet here, where you swallow in here, and then the tummy, and then a little bit of the small intestines. To the right of the picture is the liver, to the left is the spleen, the diseased liver actually. And the lower GI tract, as you go further down, is the colon, right? So it's a very wide topic to discuss on, a lot of symptoms, a lot of diseases to cover. But if I suppose in this session, I will just cover symptoms related to the upper GI system.
Okay.
Related to the esophagus and the stomach. The common symptomologies and presentations that I commonly see, or one would commonly see in our day-to-day practice clinic. The one that most people like you and me would experience, or layperson would experience. Symptom-wise, I mean.
Okay. And doctor, we also talk about this that one should do their testing. Is there some kind of a medical screening that one should go and check their gut? Because it is not widely spoken about, or maybe it's not that the awareness is not getting into people.
Yeah, the thing is, I think, let me touch on the symptoms first. The common upper GI symptoms that one would experience is something what I would term as what we all call dyspepsia, which means nothing but discomfort over the upper central abdomen, whether it be pain or discomfort, bloating sensation, excessive belching, nausea, vomiting, poor appetite. Those are the common symptoms that one would have. Some will also have things like heartburn. I'm sure a lot of us have got heartburn. We may not take it too seriously in the beginning, but when it becomes very frequent, when it becomes unbearable, then we seek help from a general practitioner usually, and they will give you some common medicines, like antacids and things like that, to help the symptoms. And most of the time, these symptoms may abate for a short period, but they commonly recur. They commonly recur meaning they're over months or even years sometimes. They keep on going to the same GP for similar symptoms, and it's not sort of gone away, not completely cured. It's then where the GP or even the patient themselves or even family members would actually approach a specialist, a gastroenterologist, So that's when they come and visit us. And more importantly than this symptom, dyspepsia, I said common symptoms, actually warning signs. Warning signs, I mean weight loss, poor appetite, lost appetite, black stools or blood in those stools. I think these are warning signs that we all have to be aware of, and something that, dyspepsia, the common symptoms happens at the beginning, but all these warning signs happen much, much later. I think we shouldn't wait for these warning signs to happen. We should seek help even much earlier. And you asked me about tests to be done. Commonly, when patients present with, let's say dyspepsia, as I said, all this bloating and belching and all that, initially, after examination and questioning the patient, or maybe some blood tests, I would just put the patient on some medicines for 4 to 6 weeks, right? Commonly. And if they do not improve or the symptom recurs, is when we would suggest an endoscopy test, things like an upper endoscopy called esophageal gastroenterologist or a colonoscopy. The other thing is that the question you asked me was to when to do this test. Let's say someone who's asymptomatic, let's say you do not have any symptoms at all. When would be the right time to do this test? I think the right time to do this test, endoscopy, would be when you reach the age, turn 50. That would be the cutoff point. Or if there's family history of cancer in the first degree relative or things like that, then you may want to carry out this endoscopy test earlier, whether it's a gastroscopy or a colonoscopy, either one or both.
Doctor, it's very interesting because as we talk about, medical check, medical screening, blood tests, HB1AC, they do all these tests, especially when, someone having a pain, that means a symptom, the body is giving you a signal that, it's not okay. But, if I'm going to have a shoulder pain, then probably I need to see an orthopedic. If I'm having a flu, then probably I need to see a GP. The body is a very clever mechanism, or such a beautiful mechanism. But to identify that something related to the gut, because the food, the digestion, what we eat is what we are. We always hear this, but for someone to understand the problem, what will be the best? If let's say if I'm the upper tract, you say the GI upper tract. When I got some kind of sensation, or someone having a sensation, does it mean that maybe it's gastric, or maybe self-medication? That's why a lot of people do that, and it's fine, you will go off, or they will drink this called of cooling water, or even in the Indian culture, they drink this called Omam water, and the mothers are very well known in that aspect. What will be the sign and indication that someone has to look for a specialist and understand what is it all about to do a testing?
Yeah, as I said, when there is a lot of bloating sensation, upper abdominal discomfort, maybe a burning sensation, pricking pain, poking pain, whatever they call it, heartburn, severe heartburn, excessive belching, right? That does not go away with medicines from the GP. That means they go and visit a GP for symptoms, short duration, maybe 4 to 6 weeks, or maybe less than 2 months or so. And they're usually given certain medicines, either antacids or medicines that we call proton pump inhibitors, PPIs. And these medicines will actually, most of the time, the symptoms should abate, right? Now, when someone presents with an upper GI symptom, and I said bloating and so-called gastritis and things like that, there are a few other things that gastroenterologists should keep in mind, or most people should keep in mind, doctors, I mean, feel that is that besides the tummy, the other symptoms, the other systems that could present or mimic a gastritis attack, acute gastric attack, would be cardiovascular. Someone with a heart attack could also present with a gastric pain. Somebody with a stone in the gallbladder, could also present with such pain. So I've seen patients coming to my clinic with severe abdominal pain, seen a GP a week before, had a couple of injections, given medicines, all appropriate medicines for gastrointestinal tract, for his acute gastritis or peptic ulcer disease, whichever it is, and not getting better. So when they don't get better, when they come and see a doctor, I think one of the things that we should always look for or think about is other organ involvement, particularly the heart. The lower part of the heart, the inferior part of the heart, presents typically with upper abdominal pain. So somebody who comes in, the symptoms abate with medicines, they get better, but it doesn't go. That means they take medicines for 2 weeks, they feel better. The moment they stop medicine, it keeps coming back. I think that's an indication to go for a further test. And usually I would recommend endoscopy. There will be some patients who are not keen to do endoscopy for whatever reason. Then there are certain other tests to be done, such as a urea breath test, to detect a bacteria called Helicobacter, which is a class 1 carcinogen, as classified by WHO, which can cause gastric cancer. So there are patients who come in, they are, for whatever reason, they are scared to undergo endoscopy. So endoscopy is actually a very simple procedure which is carried out with sedation, with hardly any risk. So there are patients who come in and tell me, doctor, I do not want to go for endoscopy. Then they'll ask me for alternatives. So then I would suggest just an ultrasound abdomen to look for a gallstone, an ECG to make sure the heart is okay, and then to do this breath test to confirm whether he or she has got this Helicobacter infection. And then we'll take it from there. If they still don't get better, then finally most of them will agree for endoscopy.
Thank you, doctor. Thank you for that. But doctor, you made a very interesting point here, because, like I said, most of the time, people tend to self-diagnose for themselves, especially, especially the things gastric. I mean, of course, it's mummy love, parents love. They always try to, give all these symptoms of the other doctors, but unfortunately, it is more to it, because I believe that when there's some kind of indication by the body that's giving you, you got to listen to it carefully and act upon it. But if you don't act upon it, then could be more serious trouble, may trouble you. But talking about this, doctor, when someone has a very consistent heartburn, we call it heartburn, indigestion, then they go and drink some cooling water or coconut juice, and then it goes up. But if it becomes a very regular, consistently, do you think that will be a time for them to go and get checked up, rather than thinking that, oh, I add something like, lentils, that's why I got these indigestions? They do this self diagnostic, which I need to hear your advice, doctor, on this.
I believe so. I think you're right. If it's persistent, it's severe, and if it's affecting their day-to-day lives, and sometimes loss of appetite, inability to eat, loss of weight, I think they should go for endoscopy. But as I mentioned, the first point of contact are usually the general practitioners, the GPs. So usually they visit the GPs first. It's actually the duty of the GPs to assess and then send them over as soon as possible. As you said, the so-called doctors and are the family members, right? Mom, dad, grandparents, who would self-medicate and self-diagnose, things like that. And when it doesn't get better is when the first contact point is GP and then only to us. But if symptoms persist with all these warning signs, as I told you, I think they should go and visit GP. More so if they see dark stools, dark tarry-like stools, weight loss, loss of appetite. I think they should visit a gastroenterologist or sometimes even a general surgeon to get an upper endoscopy done, because these symptoms that you talk about, heartburn, is actually a medical condition that we call GERD, gastroesophageal reflux disease, right? And this acid exposure over the esophagus would eventually lead to erosions, ulcers, and even later on, even cancer, esophageal cancer. Coupled with other risk factors like smoking, red meat, dietary, and alcohol, it makes things worse. So if these symptoms are there and they are persistent, I think endoscopy and seeking help is a must.
Thank you, doctor. Thank you for that. That will be definitely a great one, because if there's pain or symptoms, or if it's a very not a very pleasant thing that someone facing throughout the whole body system, if you feel a pain on your chest, then you should go and go to doctor immediately, not just say muscle cramp or so.
Even heartburn, as you mentioned, Vance, very clearly, though it's usually a sign of reflux or gastroesophageal reflux disease, it could also be other causes. It also could be something to do with the cardiovascular system. So you should get an ECG, some basic test for the heart to rule those things out before you even go in for endoscopy. So a patient who presents to me with these symptoms, I would evaluate him or her thoroughly if I decide that fit for a scope. I've seen many come in, which actually 20-25% of my patients who come in to see me for a gastro issue or a heartburn issue is actually have a cardiac issue. It is something that people must be aware of, and doctors know, but sometimes they some of them overlook it.
Before we take this particular question that asked by Ashwin Siva, Dr. B, there's always been a myth, or maybe it can be truth, sleep on your left hand side because it's better. No, sleep on your right hand side because if you feel indigestion. So there's a lot of left versus right, and sleep center straight, and face down and kind of stuff. What is your take on that, doctor?
Well, I think there's a condition called hiatus hernia, whereby the lower esophageal sphincter is a little loose, and that can cause reflux, and especially at night when you sleep. For those patients, then I would just say a slight head tilt would be good with 2 pillows or something like that, or maybe sleeping outside. But otherwise, I don't think there's any truth in those things.
Thank you, doctor. Thank you for that. So, viewers, if you hear that from the doctor,
then I'm quite sure.
Okay. So, doctor, maybe we can take this question because there's couple of questions that came in by a viewer. So, Ashwin Siva has asked about ulcers, severe ulcers. What can be done or food to avoid? But I think what is most important probably is we need to identify the issue first before we can even jump into the food. That if that's what Dr. Mohan is saying.
Yeah. See, this is a good question. When you have gastric ulcers, so let's talk about ulcers in the upper GI system. An ulcer in the tummy could be either a gastric ulcer or a duodenal ulcer. Gastric ulcer means ulcer in the stomach wall. A duodenal ulcer means ulcer in the small intestine, the beginning part of the first part of the small intestine. The difference between these two is generally gastric ulcer worsens with food, whereas duodenal ulcer actually improves with food. That means when you eat late and things like that, the pain worsens. That's usually duodenal ulcer, and gastric ulcer usually gets a little worse when you eat food. The causes for these ulcers commonly certain medications like painkillers. People would have chronic back pain, as you said, neck pain, shoulder pain, whatever it may be. When they take painkillers, NSAIDs, non-steroidal anti-inflammatory drugs, this can actually induce ulcers, right? Secondly, as I mentioned, this bacteria Helicobacter pylori, which is an important cause of gastric ulcers and cancer, can also cause this. These are the common causes I'm talking about. Okay, and they present usually with severe pain, as I mentioned, with or without food. Some will tell you it worsens with oily food, worsens with spicy food, and things like that, right? And these symptoms usually they would abate to some extent with antacids, magnesium trisilicate and things like that, and Gaviscon, those syrups. And if it doesn't, that's when they progress to take the other group of medicine called PPIs, proton pump inhibitors, right? And these medicines will help, certainly, if it's truly an ulcer, to heal ulcers, right? And if it does help, and if they do recover, it's fine. But most of them will recurrently see the GP, not just once, many times. That's when they need to put their foot down and say, okay, look, we need to get an endoscopy done. Food-wise, the only thing I can tell you is just avoid oily food and not too spicy food, like those sort of things. Mainly oil. And sometimes even milk products also worsens its ulcer. With regards to treatment, it depends on what the finding is. If it's just a painkiller, then they need to avoid the painkiller, stop painkillers, and look for alternatives, and start proton pump inhibitors for a duration of 4 to 6 weeks or up to 8 weeks. And if it's Helicobacter pylori, then they need some antibiotics together with this for a duration of 2 weeks.
Thank you, doctor. Thank you for that. I have a few questions that's come in, so I'm going to help to bring up these issues up by our viewers. I'm just going to pull that up right now. So we have this question by one of our viewers, and I think 2 questions that already came up. Can prebiotics or probiotics help issues with the gut? She asked us this.
Yeah, it does help. It does help, definitely. Especially, I usually start these medicines after clearance of Helicobacter pylori. Once I've cleared the gut with this, with those who come in with those issues, once we clear, prebiotics and probiotics certainly helps to get the gut flora balanced.
All right, doctor. Another one. Do you want to still go on that, or we can go over the next question? Okay. We also have Sarah. I think Sarah is actually a dietitian. If I get that correct, Sarah. So she asked us about how to treat SIBO.
Okay. SIBO is usually treated with antibiotics, cyclical antibiotics.
Okay. So that will be the thing.
Yeah, cyclical antibiotics. 3 weekly antibiotics, maybe 2 or 3 courses, and it's a very difficult condition to treat.
Okay.
Ciprofloxacin or even tetracycline, things like that.
Okay. It looks like, doctor, it's lots of issues that can be related to the gut. When we say about indigestion or heartburn or gastric pain, so just now we mentioned about the yearly screening. So you think once a year is good enough, or you think one should do every 6 months once?
I think it's like this. Once, let's say somebody who does not have any symptom, and I said when you reach 50, you got to actually go for endoscopy, screening endoscopy, which is upper and lower scope. Once that is done and you're cleared of it, there are no polyps and things are clear, there's no pylori. I think once in 5 years is fine. 3 to 5 years is fine. Don't have to do it. An endoscopy screening isn't conducted every year unless there's a necessity. For instance, if there's a family history of cancer, or if there were polyps that were malignant or pre-malignant, then you may want to do it a little earlier, maybe 2 yearly or 3 yearly. Otherwise, once in 5 years is fine.
So, doctor, we have another viewer here by the name of Sopna. She asks, "Hi, Dr. Mohan. What measures can we take to improve our gut health?" I mean, that is I think a common thing that a lot of them are asking, because related to this, because I think they want to do some minor adjustment in their lifestyle, if it's not too late for them.
The important thing, as you said earlier on, to lead a stressless life, that's quite impossible, right? Eat regularly, eat on time. I think it's very important. Prebiotics and probiotics certainly help to maintain the gut flora, which is very, very important. Eating a balanced diet, meaning sufficient vegetables, proteins, carbs, and all that. and make sure. I feel you should not take too much of oily food and spicy food. I think you got to go a little, a little bit. We all got to be a bit careful with those kind of things. Prebiotics and probiotics definitely help, but every doctor will tell you something different. But I think prebiotics and probiotics would certainly help.
Thank you, doctor. Thank you for that. So definitely stress is one of the factor as well that we are talking about.
It definitely raises there's a brain gut axis, but will definitely increase acid levels and all that in your gut, in your tummy.
So, doctor, like earlier we had a discussion and you were asking me if I have done any tests and all that, and I was like to know. So it shows that, not even once a year. So at least every 3 years, you think that should be just good.
I think
But I
you
think
mentioned
a lot of them are afraid of this endoscopy, doc. So I think, is it because something they worry that putting it through it and they feel the uncomfort?
I
Is it
think
one
they
of the
worry
reasons?
about pain and discomfort that one would have to endure while going through the endoscopy. But these days, endoscopy is usually done with proper sedation. Most of the time, there will be an anesthetist. Like in my hospital, we use the services of anesthetist to sedate the patient, and we just insert a tube, which is a very tiny tube, and through the upper gullet, esophagus, and you can view the esophagus, your tummy, stomach, as well as your the upper part of the initial part of your small intestine, the duodenum and the first part of the jejunum. That is actually a painless procedure. It takes about 10 minutes or so, nothing more than that. A colonoscopy is a little more technically difficult. With proper bowel preparation and proper sedation, it should not cause any discomfort. Just maybe a mild bloating post colonoscopy. And that procedure takes about 20 minutes or so to complete. Looking for things like polyps. Polyps are usually pre-malignant. Polyps can be benign, and they can be pre-malignant ones as well. And these polyps, if they're not removed, they will eventually lead to cancer and things like that many years down the line.
Doctor, it's like our digestive system is like, I think one of the organ that doesn't have enough rest, because constantly we are eating and the guy is constantly working on around the clock. Probably the only time he's resting is between 12 midnight to 7 a.m. Then the breakfast comes in. So constantly this guy is working on and doing all the necessary things in terms of getting all our microbiomes, which is definitely another topic that can dive in for hours. We're not going to microbiome, but serotonin, melatonin, tryptophan, so many things are happening at all these range, but we are not going to the hormones. But when we say eat a diverse range of foods, because play is a very important part. Someone who goes under a strict diet for a certain competition of a certain athlete, they're putting so much of stress on their gut. I mean, someone goes under intermittent fasting for so many hours and seeing a weight drop, and then after that it bounces back in the next 3-4 years. Do you think that, I mean, of course, you will have to say advice and expertise on that, but is the gut going under a stress, most of the trauma?
You mean when they go to this diet and all that?
Yes.
I think so.
Yeah. Okay.
Intermittent fasting is something, I don't know, a lot of my colleagues believe in it, but I certainly don't. I don't know, they believe in intermittent fasting and weight loss and all that, but I think the best way forward would be to eat a balanced diet, to eat on time, not to delay your meals. And I also believe that you should have a proper breakfast and maybe lunch and prepare a light dinner, whereby you don't strain your GI system too much before you sleep. Most of us, the problem is we eat late, and we tend to eat lots, especially at night, and then supper, and then go off to bed. I think that's a strain and stress on the GI system.
Especially you have to process all the pratas and going, especially at night.
Something I said, my colleagues they don't agree with me, but I don't believe in it. My wife believes in it, but I don't. Don't subscribe. Yeah, intermittent fasting. I think it's just torturing the system.
So, doctor, it's a very important question because a lot of them will be under a certain kind of a diet right now. So they'll be like, oh, is it? They make a bit puzzled. But eating 3 meals a day with consistent hour. I mean, some says 5 meal a day, 6 meal. I mean, probably dietitian will able to look into
A good
the
breakfast,
endocrinologist.
a good breakfast to sustain you. Not a very heavy lunch, a moderate lunch, and a light dinner. And I think not too much of snacking in between, especially as we grow older. When the BMI drops and when your metabolic rate drops and things like that. Not BMI, sorry, metabolic rate drops. I think certainly snacking in between all that will certainly lead to weight gain and things like that. So eating correctly, eating on time, and what do you call this? Sufficient amounts and adequate amounts should be enough, and not to
Doctor,
eating too much at night.
totally agree with you because when one's ages gracefully, the amount of muscle mass reduces, and then the BMR reduces, and then the whole system starts to go. Instead of going forward, it going backward. So which is, I mean, not a very good sign. Every 2 steps you take, you're taking 1 step backward. So eventually, you're not going to finish the finishing line. But of course, with so much of food that is in surrounding us, like cakes and sugars and carbohydrates and kind of stuff. But do you think that everyone should do a test, whether to see which tolerance level they are in? Like for myself, I'm very sensitive to carbohydrates. I mean, of course, we all of us love that, but it gives you a very sluggish, very you're carrying like 100 kg. Load movement is very slow. So sometimes we eat because of hunger, but sometimes we don't eat because we need the nutrition. So what will be your expertise on that, doctor?
On doing tests?
On food and on the testing of which level we are in terms of tolerance.
Well, I think it's good to go for medical tests, blood tests, at least once a year, a complete blood test, and to see whether you're diabetic and the HbA1c levels and things like that. Because as you know, if you develop diabetes at some point will affect the nervous system as well, the nerves, and this leads to a condition called gastroparesis and poor digestion, food stays in the tummy longer, things like that. So I think blood test is important, not just only for the gut, overall health, that's important. And in terms of food, in relation to your blood test, I think based on what you see, what you find in the blood test, you find that your sugar levels are up and all. Then of course you got to cut down on your carbs and exercise, introduce exercise into your lifestyle and things like that.
Thank you, doctor. We have one more question to take on. Then after that, we will just go in a little bit more into in depth of your profession and how one should be look into the gut health as well. We have a very good viewer here right now who's constantly on our show. So this is a question. The mom gets stomach pain and diarrhea like symptoms after meals. It happens quite often, but can't particularly conclude what is it due to. She's someone who's very careful with food. She's been for the scope and not able to confirm the exact problem. What will you propose?
Okay. Well, if she's been for the scope and they're unable to conclude what the symptoms are, I think I mentioned to you Vince earlier on. I find that a lot of Indians, North Indians, South Indians, and even those Westerners, they've got this gluten sensitivity. I find that wheat makes these symptoms worse. The stomach pain, bloating, and diarrhea. I think the symptomology, what she's put up here, people would just diagnose it as what they call as IBS, irritable bowel syndrome. They call that the dustbin of gastroenterology, where when you cannot find anything, they'll say it's IBS, right?
Okay.
Very difficult condition to treat, right? Like what this lady is going through. My suggestion would be, has she been for the upper scope or upper and lower scope? If she's been for one, she should go for both to make sure there's nothing wrong with the entire gut system. If that's all good and there's nothing conclusive there, then the next step I would take would be just to avoid gluten, just gluten for maybe a 3-month period and see whether the symptoms abate. If it doesn't abate with that, then I suppose we need to look at many other factors. Sometimes patient presents with diarrhea after meals and stomach pain. There's this condition called microscopic colitis, whereby the colonoscopy, everything appears normal, But when they take a biopsy, look at it in the microscope, at the microscopic level, they can actually see inflammation in the colon. So whether that was done or not, I'm not sure. So I wouldn't be able to answer this fully. But I would say if everything was done, the next step would be just try a gluten-free diet. If that doesn't work and everything else is normal, then I suppose the treatment would be treatment for IBS. There are a few medicines out there for IBS, but it is definitely not an easy condition to treat.
Thank you, doctor, for that. One thing we have to understand, this operating manual of our human body is never easy. I mean, doctors spend years and years in studying, and even right now, you also be probably studying right now. The education doesn't just stop there, especially for doctors.
Spot on.
And it's such a sophisticated item, or rather, not an item, operation machine that we are operating on a daily basis. But most of the things that we don't understand about this, when you buy a car, you get all the features, the buttons, you know how to do, but body we don't. Is that the humans are not taking extra precaution to understand how the gut works, or do you think that the anatomy is so much in detail that it's not necessary? How can we conclude this, doctor?
I think most of us don't pay too much attention to this, to our body, to this system. Not only this system, most systems, until a big problem arises. And the other thing is, most of us, I mean, when the symptoms are mild, whatever home remedy or a GP remedy would suffice. They would not go and seek help from a specialist because of their schedules, busy schedules, etc. So I think that's something that all of us need to address. If there's something wrong, we need to look at it, with a little more seriousness and take interest in our own body and seek help. Seek specialist help from appropriate specialists, whatever it may be, cardiac, gastro, whatever. I think that's where.
No, I did a basic anatomy, and I'm still pursuing my studies on different aspects on the human body and even mind and psychology and so on and so forth. But one thing I've understood, that there's no full stop. There's always a question mark, and there's always a comma to understand this marvelous operating machine of our human body. And even if you look at these sentences, the human body is approximately about 30 trillion human cells, but there are 40 trillion bacterials. We know that our gut also contains bacterial. Shall we talk a little bit on that versus the good versus the bad, and how this is being overcome?
That's maybe a different session.
Too deeper? Okay. Then we will move on to the next one, doctor. So the next segment that we're going to go into, of course, the gear 4 that we always like to talk in the talk show. In your line of your expertise, doctor, what is the most common area that you see? Cases.
Huh?
Yeah.
Okay. The commonest I see that are those who come in with GERD, reflux disease, and peptic ulcer disease. And those who come in with altered bowel habits. That means they normal bowel habits, and then all of a sudden it's to a couple of months of constipation, or a couple of months of diarrhea, or alternating bowel habits, and weight loss. Common symptoms would be bloating and excessive belching. Someone's in, and then followed by weight loss. And the common diseases that I see is one, reflux disease, GERD, and peptic ulcer disease, secondary to gastritis, secondary to Helicobacter. And the other type of cases that I commonly see are, as what I mentioned, irritable bowel syndrome, IBS, where because of stress, everything is normal, you can't find anything, and that's the diagnosis. That's the difficult one to treat. It's usually dietary, stress, and a little bit of medicines. You got to play around with this and then get them better.
We have another question, doctor. Let me pull up that. It's about gastric sleeves. Is that something to do together with your gut health?
That's sleeve surgery. That's done with a bariatric surgeon. You remember? I think you thought you had a bariatric surgeon sometime early on in your show.
Yes, we did. Yeah, about a year back. Yeah,
that's gastric sleeve surgery. That's not me.
Okay.
Surgical domain.
All right. So that will be answer for that. Doctor, we have almost covered every single part of the discussion today. I know
the lower GI, I'll probably do on another session with you.
Okay, definitely. It can be a very detailed. I know it bacterials and so forth. We can talk this for hours and hours. But what we can understand in this session itself, I think, if there's some kind of pain or symptoms, you should go and check with your GP first, and then probably your GP understands better, and then he will refer to a specialist to look
Correct.
into more deeper to diagnose the situation. Am I right to say that?
Absolutely right. So what I'm saying is that whenever there are these upper GI symptoms, which I call dyspepsia, which is bloating, excessive belching, heartburn, poor appetite, loss of weight, nausea, vomiting, I think the first thing to do is to seek help from your local GP and to assess the situation. Make sure he rules out other causes, as I said, gallstones and maybe even the heart, and treat you initially if it's not an emergency. And if it doesn't get better over the ensuing 4 to 6 weeks, then definitely your GP has to send you for a further evaluation, either for an ultrasound or an endoscopy, to see a specialist, whether a surgeon or a gastroenterologist, whichever that may be. I think there's something that we all should be aware of, and that should be the take-home message for this session. Because I'm just focusing on the upper GI system, not so much on the lower GI, where there's altered bowel habits and blood in the stools and polyps and things like that.
Thank you so much, Doctor, for this past almost 47 minutes. And we have a very good constant flow of questions that came in. And thank you for taking time on answering on that. Doctor, any last advice that you want to give it to our viewers, or anything that you want to say regarding about the gut? I know we have spoken about the upper tract system, GI tract system, but is there anything that they should be taking in, taking back any more details?
Nothing more. I think I've said everything.
Okay.
Stay safe.
Okay. Doctor, thank you so much. I know we're going to meet up again for another session over the next few months on understanding. Maybe we can go into a little bit of microbiome, or even the lower GI tract, and understand a little bit more. But today's introduction is very great, because we do understand, and I think that the viewers are giving questions to our specialists here on how the system works, and certain things they are very concerned about is the heartburn, the ulcers, and also a few things like digestive systems and so forth. So I really thank your valuable time for today for joining us at Kopi with Vance, and we will take it on more on our next coming topics, and to understand more better about the gut health.
Sure. Thank you, Vance. Thank you so much.
Thank you, Doctor. Thank you so much. And we will catch up really soon once the borders are open.
Thank you so much for having me on the show. Thank you.
Thank you, Doctor. Thank you so much. And we have also a few more. We have, okay, Doctor. So, Doctor, you have health. So, David Street has said, I suffered and Dr. Mohan helped me. I'm much better. Thank you so much, David Street. So it's good that she's here, and then she actually have. She's sharing a situation. Maybe, Doctor, do you want to touch a little bit on that? Is that okay?
Yeah, I can.
Yeah.
Well, IBS is not an easy condition to treat. It's a diagnosis of exclusion. That means when someone presents with GI symptoms, maybe upper, it may be lower GI symptom, altered bowel habit, bloating, things like that. You need to actually rule out a pathology first, meaning organic cause, meaning an ulcer, or whether she's got some polyps and a mass, cancer, things like that. Once all that is ruled out, then you call it a functional gut disorder, meaning with regards to IBS. So IBS is described as a functional gut disorder. There's no organic cause for the symptom, right? And IBS is particularly linked to two important factors: one, diet, and number two, stress. So the brain-gut axis and things like that is something not easy to treat. Not easy to treat, and it's a lot of trial and error. And medicines do help, advice, and some people they actually undergo counseling. Sometimes some people even practice what they call as past life regression, things like that.
Okay.
It could be for IBS. IBS is not an easy thing. So those who believe in past lives and they go into past life regression and they actually get cured for this.
Okay.
Those things, yeah. There are many,
Is
many
it
approaches towards IBS.
is it related to a little to psychology? Is it
Yes, yes,
related
yes.
to, yeah?
Absolutely, absolutely. Not easy. It's not easy. So it's a combination of factors. Most of them do well with diet, exercise, as well as medicines, but there are some who do not. And that's where I know of some patients who have gone off to a few renowned experts and they've done hypnotherapy and they've recovered. I've seen this. There's this book called Many Masters, Many Lives by
Many
Brian.
masters, that's okay.
Yeah, you should just read that book and maybe you will understand this a little better. Very interesting book.
All right, I already took it down already. So next time I'm going to talk to you, you're going to ask me questions, and I'm going to answer you that.
Thank you so much.
Many
Bye-bye.
masters, many options.
Many lives. Many masters,
Many
many
lives.
lives.
Right, okay. Many masters, many options. Okay, viewers, please take note there.
It's Devastri Balan, yeah. There's
Yeah.
another guy show just now. I saw him. It's Hitendra. He was he's an orthopedic surgeon in Singapore. Hitendra.
Yes, he is. Yes, he's one of our guest speaker in Dr. Itendra has spoken at Kopi Reds for twice.
Yeah. I know him. He was a medical student when I was in KLGH.
Okay, so all are your buddies, huh?
Very well. Very smart chap. Smart boy.
Handsome too.
Yep,
He's watching that. Okay, now Dr. Itendra is time to come back again. Yeah. Okay.
Sairam Hitendra.
Yes, he is. He said that, Sairam. Thank you, Dr. Mohan Raj, for joining us for the past almost going to be 1 hour. And I really thank for your valuable time joining us and bring some light about digestive systems. And of course, talking about the upper GI tract and the medical screening that you should do every 3 years. So I'm sure all these valuable inputs that our viewers will take back. And if opportunity is there with the time, and we definitely want to welcome you back again for the second round to talk a little bit more in the upcoming months.
Definitely. It's my pleasure. I will do so.
Definitely. Thank you, Doctor. Thank you so much. So for right now, stay safe. Thank you, Doctor. Thank you so much.
Bye.
Thank you. Bye-bye. All right, viewers. It's another close to 1 hour of Kopi with Vance. And like what Dr. Mohan Raj has said, the digestive system, the tract, it's a huge thing, the intestines, the upper, the lower, the functions, the microbiome, the hormones, the chemicals. We can talk and talk and talk until the cow comes home, right? But I think the most important thing is we keep it short and simple, understanding the importance of our body system. And, if there's I always tell in my show that when the sign and symptoms of your body is doing, you got to listen to that very carefully. You can do certain self-medication, I got a little swell on my muscle, you do that. And if it feels like sharp and pains and needles are actually a symptom that the body is giving you some kind of indication. And it's a very clever mechanism of our body. Sometimes we choose not to listen to it. Sometimes we take it too easy. Sometimes we don't pay attention. Sometimes we don't even give the care, concern, and love to it, right? We do all other stuff except taking care of our body. In fact, there's a lot of stuff that I want to talk about in terms of 7 things you can do to your gut health. And I think Dr. Mohan Raj has clearly explained the system. But very important is get enough sleep, stay hydrated, eat slowly, check for food tolerances. It's also very important. Intolerances are very important. Change your diet. I think it's always important to check with your dietitian. Clinical dietitian is very important to understand your blood type and what kind of food works for you. And of course, lowering your stress level or chronic eye level stress, especially for those who are in the industrial where you got to sit and look at 7 or 8 computers, or even working on a certain targets or sales targets. You're putting under your body is so much of toxin, and your whole system just breaks down, including your gut as well. So you got to change your diet, change a lot of stuff. You got to turn inwards, right? Always we are turning outwards. If you turn inwards, your body will be very grateful. Our body is like a temple, so you got to take care of it, make it clean, do whatever is necessary, invest in it. Go for a walk. Do whatever that you feel that you are happy. Of course, stay away from alcohol, smokings, and all that. Not too good, right? So it's never been. yeah, we have come to the end of the gut health. We have interesting topics coming up, and that's going to be another two shows coming up because we have few talks that's already lined up, which is usually is Wednesday at 10 p.m. But because of the many speakers are coming on board, we have now allocated, or I have allocated, two talks per week at this point of time. But we are going into different series at the moment. We are still keeping the health as the first priority, but we're also going into lifestyle videos, which you have seen in the past of Kopi events where I went into bikes, went into cars, went into lifestyle to get yourself engaged mentally, physically active. So lots of hobbies are going to come in, lots of collaborations are there. Stay tuned because you're going to win a lot of stuff as well, for Q&A answers, and you'll be in a very active viewers at Kopi events with lots of love and messages coming constantly. And if you do have any question, or if you do want to contact me on any of this topic that we talked about, and you want to give your support or give some suggestion, this is the number. All right, 818-77850. It's only for WhatsApp. Please do not call. Calls will not be entertained. Only WhatsApp. So if you have any inquiries, any suggestion, any feedback, that is the number to get in touch. All right. I've said enough. Stay safe, stay healthy, wear your mask, hydrate yourself, be good, and see you on Tuesday at 10 p.m. with another topic that's coming your way from Kopi with Vance. Till then, signing off. Vance, I see ya.